This patient came to see me for endodontic treatment of tooth number 3. Patient denies this tooth ever being traumatized, but as you can see, there is inflammatory resorption associated with the tooth, and patient has symptoms. So we discuss options with the patient. We could try to go ahead and clean up this affected area, clean it up, repair it, go ahead and do the root canal, and then see what happens. That's one option, guarded prognosis, or the other option would be extraction. This patient is younger, and she says she wanted to try to see if we could save the tooth for her. And here's the date. Take a look. 6 months ago, when we first saw her for consultation. So we went ahead and did the root canal for her in one appointment, and this was immediately after we did the root canal for her. And again, you can see right here, 6 months ago. Today's 7/16/2024. So take a look here. We accessed the tooth, of course, removed all the affected dentin and the inflammatory tissue. Also, there was soft tissue, all the blood vessels and what have you that had grown inside of the tooth to bring in the inflammatory cells to eat away at the tooth and basically reject it. Cleaned it all out, soft tissue and hard tissue. I used gray MTA and repaired the areas, tried to seal the areas that were affected by the inflammatory resorption, and went ahead and did the root canal for her. And here's, as I said, immediately after we had done the root canal for her and the repair with MTA. And again, here's the date, as you can see, 6 months ago. Today's 7/16/2024. And this tooth did not have an MB2. There was no MB2. This is another angulation. Another angulation here. Another angulation here. You would think that's an MB2 and I missed it. But yeah, there was no MB2. Okay, so patient came in for her 6 months post-op of this tooth, and take a look. She came in yesterday, so it would have been 6/15. And this is the 6 months post-op of tooth number 3. The inflammatory process, as you can see, has stopped. Tooth has been restored permanently with composite. And here's the date, yesterday, when I saw her for a 6 months post-op. Tooth is in full function, asymptomatic. Patient has as I said, asymptomatic. Tooth is in full function, no periapical lucencies or anything like that whatsoever. As you can see, the inflammatory process has stopped. Let me show you another angulation of the tooth. This is another angulation of the tooth, and you can see there was no MB2. And again, here's the date. So 6 months post-op of tooth number 3. As I said, tooth is in full function. Patient is asymptomatic. The inflammatory process has stopped. All right, so 6 months post-op of tooth number 3. We were able to save this tooth for the patient.